Hello, thank you for watching and listening to our Central Island Pain Program orientation slideshow. We're going to go through some of the details about how our clinic operates, and we will also go over some information about management and rehab programs that are available through our clinic. Some of the things you need to know about our program and some reminders are that make sure you always check in at our front desk. We need you to have your care card and present it each time you show up. And this is really important. So please remember also that your first doctor's appointment will be a consult only. That means that you'll have an opportunity to sit down with one of our pain doctors who specialize in this area, and they will discuss your options before doing a procedure. If you are booked for a procedure, keep in mind you must have a ride home. If you don't, if you show up and you've driven here that day, we actually will cancel that procedure. So please plan ahead and have somebody available to drive you to and from that appointment. Please cancel early if you know that this time and date doesn't work for you. And that applies to the doctor's appointment and our classes. Note as well that our doctors do not write prescriptions. They will make recommendations in their notations that will go to your GP, and your GP will then be responsible for managing those recommendations and modifying your medications as needed. Keep in mind, we are not the Nanaimo Pain Clinic. There is a clinic in town called the Nanaimo Pain Clinic, so if you call a cab or if you have paperwork sent to the Nanaimo Pain Clinic, you may not end up with your information or being at the right place. We are called the Central Island Pain Program, and we are located in the Nanaimo Regional General Hospital. So make sure that your information and your ride are taking you to the right place. Please note also our doctors and therapists do not make recommendations or write letters for WCB or ICBC claims. Please contact your case worker, your case manager, to discuss that. Some of the treatment options that you might discuss with the doctors when our clinic is operating would include injections with anesthesia and or cortisone. So that might be something that you discuss during that consult. However, just keep in mind that there's quite a few of the patients that are referred to our program that are not interventional. And for those who do or are interventional candidates, they can expect about 30 to 50% relief in their symptoms, meaning that their symptoms will be likely reduced, but not 100%. So a lot of our patients expect, 100% relief, no pain, but that isn't reality. In most cases, we can have an effect, but not 100%. 50% of those treated will actually experience a reduction in their symptoms, meaning that there is a good portion of those who do receive injections that have no change in their pain symptoms. So just keep that in mind as well, that these procedures can be effective, or in maybe just as many people, they may not be effective. With any treatment reduction in your pain, the intention is to allow you to participate in therapeutic and activity programs, including those that we offer here at the pain clinic, meaning that if you get a procedure, the idea is that it's hopefully building on a self-management program that you're already participating in or you're starting. That includes gentle mobility and doing some strategies that will help reduce your pain, and we'll get into that in a little. The way our program works is that the first session, and now we're making this online so that we can reach some of the people who maybe we wouldn't have been able to reach in the past, or because of a closure, you're able to watch it this way. We have this orientation, and then from there, usually most people will either have a doctor's appointment or they will be sent information about how they can access the rehab part of our program. Now, generally, most patients will also be referred, regardless if they've seen a doctor or not, to our rehab program. which includes a class about pacing and breathing, and that's how to move and working on relaxation strategies through breathing. As you can see below, the low back pain, LBP, low back pain, SI joint, that's an area we see, we get a lot of referrals for that body area, neck, and then other parts of the body. And you can see underneath that there are different groups and different resources that will be effective for that, for treating that area. So concerned about your x-ray or MRI findings. This is actually post-rehab up in one of our doctor's offices. And this is just a quick reminder, if you have the chance to just peruse a few of them, especially the cervical spine and the lumbar spine. Just take a look at those numbers. And what it means is that we know that most of our patients have had MRI or CTs or x-rays, and they may have shown some sort of degenerative changes or something that may look abnormal. And, the radiologist report might say things like, degenerative disc disease and things like that. And when you read that, it can be a little bit scary and a little bit daunting to know that there's something's wrong there. But in most cases, these are normal changes. These are normal processes that happen, unfortunately, that come along with normal aging. So again, just take what you see on these imaging with a grain of salt. Have them interpreted very well by your GP and by and our doctors here as well. Will give you a better sense of what to be really concerned about and what is unfortunately just a part of normal aging. As you can see, here's another slide that just presents some data on normal aging process statistics. So you'll see at the top bar there's ages of 20, 30, 40, 50, 60, 70, and 80. And then all the different, or a lot of different degenerative processes that can happen in your back. And you can see at 20 years old, we're already 37% of the population is already demonstrating changes in their disc height and having disc degeneration. And again, that's just normal processes of wear and tear and gravity and aging on our bodies. So, and you can see that goes up pretty significantly on that top row to up to 96% when we're in our 80s. What's interesting about this though is that these patients are asymptomatic, meaning the people scanned didn't have any pain. They don't have pain. So we can have these degenerative processes like disc bulges and protrusions and degeneration and not have pain. So when you see those reports, those details on reports that talk about the changes that have happened in your spine, not all of them necessarily are going to be causing a painful outcome. Mechanical changes from age or injury, we do know definitely some of these conditions and some of these processes can press on sensitive areas and cause pain for a lot of our population, and many of which may have very few or no treatment options, or some of the treatment options can be pretty invasive, like talking about surgery. So we want to talk about how we can reduce that pain that you're experiencing and hopefully address the nervous system and calm it down so that you can have a reduced sensitivity. We'll get to that a little bit more. So receptors that sit in neurons, they respond to mechanical changes, chemical changes, temperature changes. What's important to note about these little receptors that you have all over your body is that they are replaced every few days by fresh sensors. About every 3 to 4 days, you get a new set of these receptors, and they turn over in whatever state your body is currently in. So if you're reactive and responsive with the current set of receptors that you have, then likely the next set is going to also turn over in that state. Now your alarm system works something like this. You have a danger message that's sent up to the brain. In this case, you can see it's at the finger. A nociceptor is picking up on something and it's sending it up the peripheral nerve. Now the spinal cord makes a bit of a decision on whether this information is important enough to send up to the cerebral cortex. If it does seem like it's important enough, that message gets passed through the thalamus and then is interpreted by the brain as being dangerous or not. So keep in mind, this is a protective system. It's the way your brain decides if information is truly threatening to tissues, and then will make pain if it says, yes, that's dangerous. Something's happening to the finger and we need to get it out of that dangerous situation before it becomes further injured. Then you make pain. So we always say that you can't have pain without a brain. Your nervous system is made up of the central nervous system, what we just discussed, mainly talking about the brain and spinal cord. And then there's also the peripheral nervous system, which is really important to also consider when we discuss chronic pain. This is also where the sympathetic and parasympathetic systems run. And that, again, we'll get into a little more detail in a minute here about the fight and flight response when you have chronic pain. Now, changes to nerves are something that happens when you have pain that persists. So pain that lasts for a long time seems to have an effect of adapting or changing the way the body works with the pain system. So the threshold for danger signals lowers so that they get excited more easily. The neuron believes that you need more protection because it's getting this, constant stimulus. So it feels like we need to protect this body more. So it sends the danger signals to the brain more easily than it would have normally. So you have like a lower threshold. The danger neurons usually have a rest period after sending those signals. In persistent pain, this rest period decreases, allowing for more dangerous signals to be sent. And then the danger neurons start to release more chemicals out of the sensor into those tissues. These chemicals produce inflammation and are released because your nervous system thinks if there's that much pain, there must be a need for a lot of protection. Inflammation is a protective response, and this produces swelling long after the tissues have healed. You have relay neurons in the spinal cord, and they become more easily excited the longer your pain persists. They will require fewer signals from your body to feel pain. The neurons in the spinal cord build more sensors. With pain persists, with more sensors, they can detect more danger chemicals and send the danger messages faster. So basically, the nervous system starts to change. The alarm system gets louder, feeling like I need more protection for this body. So let's try to protect it further. So the neurons in the spinal cord that send danger signals can misinterpret normal sensations. So somebody touches near that area, or you stretch that area. The danger signals get triggered, and this means that you can get pain from some of these normal types of movements and sensation just because your body is going into this hyperactive protective state. So mapping also changes in the brain. So this is something called the homunculus, or the map of the brain, and where your body parts are represented on that map. That starts to modify when you have pain for a long time. So the map of the body part that's injured becomes bigger in the brain when pain persists. More neurons in your brain will be dedicated to paying attention to that painful area. So when the map changes, you'll have less ability to sort of contract and relax those muscles. You'll have poor coordination between the stability muscles, outer mover muscles, and it causes those movements that kind of feel uncoordinated and awkward, and it also can make it feel like that joint is stuck, and spasming in that area usually happens as well. So also you start to feel like there's something wrong with me. There's something wrong in that area. And there is, but this problem is actually coming from the nervous system, the brain, that's actually feeling like it needs more overprotection for that area, and it's actually overreacting. And there's not so much damage in that tissue as much as the brain is reacting. When pain persists, the brain starts to change the chemicals it produces, releases, and some of these chemicals are hormones. They can stimulate fight and flight and freeze reactions. Again, your brain is basically getting that message over and over again that there's something wrong. So the brain starts to go into those panic states of fight and flight. And those reactions feed back into the pain system, increasing that sensitivity even more. So pain becomes like a familiar tune or pathway played in the brain. The longer you feel it, the more you start to have more signals coming from your body, or even though there are no new signals coming from your body, you can have pain. So the longer you have it, the more things will trigger it, unfortunately. So this diagram is just a quick little, it just sort of gives you a thought process around chronic pain. So you can see that stress is in the middle here, but any single one of these around the outside here can be a trigger. So many people will note that if they have a bad sleep or they notice muscle tension, their pain goes up. But we also notice things like stressors in your day. You have a bad day, somebody yells at you, or even things like temperature of a room for some people can now start to trigger a painful response from the body, from the nervous system, because what's happening is that nervous system has become so sensitive and so protective that some of these things that aren't dangerous to tissues are now causing the brain to feel like it's under threat and make pain for it regardless if it's threatening to your body or not. So hopefully that makes sense, that you can start to have pain from triggers that aren't actually dangerous to tissues. So as we were talking about earlier, that autonomic nervous system is affected, so the fight and flight response. So normally we're meant to sort of stay in that parasympathetic or stability state. You hop in and out of survival mode when you need to go into those panicked emergent states of run for your life. But we're meant to go back into stability mode when that urgent episode has passed. We find, though, that people who have chronic pain tend to stay too long and spend too much time in that survival mode. And what happens, imagining your body is in that sort of stressed out panic state, what do you think happens to the body? Well, and here's a few examples. A wound up nervous system affects your immune system. People tend to get, feel run down and get sicker more often. Your digestive system can experience different changes as blood is usually rushed to the extremities of the body to get out of danger. Cardiovascular system, typically when you're feeling like you're under threat, your heart rate goes up, your blood pressure is affected. So that's not a good place to be for the long haul. People usually have trouble getting to sleep. Remember, there's sort of that alarm system going off in your brain saying, run, run, take care, run, panic. And trying to get to sleep when that alarm is going off is very difficult. Your ability to concentrate, focus, think, remember, get work done. Usually people stop socializing because of this anxiety and stressors. People stop moving, doing their activities. Self-care typically suffers, and your ability to sort of manage those stressors and your mood is definitely affected as well. So, initially pain will tell you about damage in the body, that acute pain, that early on pain. Put your hand on a hot pot of water, and the pain system tells you your tissues are about to get injured. That's the ideal pain system, is when it's working properly. But with persistent pain, when that pain goes on and on and on, and the body starts to modify and adapt to increase or improve on the process, it's now telling us the nervous system is wound up and really overreactive. So this is a cube. This cube just is an example of, if you can see that red dot there, and for some people right away you'll see it either on the back of the cube or on the front. The idea is that hopefully, if you look at it long enough, you can see it both ways. I'm going to talk about why that's important. So your nervous system is really good at learning, and that's the good news. It learns what you practice, and it is adaptable and always changing. So that's the good thing about your nervous system. It actually learned to get better at pain, so we can actually work towards getting it settled down. So we're going to use that and try to work with that to affect the amount of pain you're suffering from. You also create endorphins. Your body can make endorphins, which are natural painkillers, but they're not as easy to access as opening a bottle of painkillers and taking a pill. So we're going to talk a little bit about how we can access those natural endorphins. The role you play is what's so important about pain management and self-management. And all of our doctors work here will also reiterate how important it is that we are involved and engaged in these programs. So what the brain pays attention to can be influenced by you. What that means is we need to have an awareness of what things are truly dangerous to my tissues and what things are triggering off and increasing pain and maybe aren't threats to the body. So knowing that when I walk in a room and if it's crowded full of people and the noise from the group is setting off my pain system, knowing that that is actually not dangerous to my tissues. Nothing is being damaged there. Or if I want to go out for a walk and my body is maybe anxious about going for that walk because I've had a bad experience with walking. Knowing that if you move in a gentle way, you're safe to do that. I'm still safe to do that. I'm not harming any tissues. So that's what that cube is. It's just sort of having that awareness. Your body used to be that, use that filter from the spinal cord to say, this is dangerous or it's not, and I can not even bother sending that message to the brain. But now those gates are open because the body and the brain are saying that something is happening here and I need to be paying attention to all these triggers and making pain for them. So remember, pain is not accurate always. We get examples like brain freeze that it hurts, but again, we know that there's no tissue damage happening with that. Pain self-management. So we're going to talk now about one or a few different techniques that we're going to talk that we have available in our program, and things you can be doing at home. Most importantly, what you can be doing. So education and understanding first means learning about that pain system, knowing that what we just talked about, that we can have pain without having tissue damage, also right away starts to reduce that threat and the value of pain, meaning that if we understand that, yes, I'm going to go out for this walk and I'm going to have some discomfort with that, but I know that it's not harming my tissues. That calming sort of voice will tell your pain system that this is okay, this is safe, and maybe even you'll have an effect on the amount of pain you experience. Reducing the threat can calm that protective system. So that's just what we talked about. If we can reduce the threat in the brain, we can have an overall effect of calming the amount of pain that you're going to experience. I'm never going to promise, no pain, but can we reduce and make it reduce the amount you're experiencing so that we can improve your quality of life? So retraining, we need to reprogram. We just talked about how the brain can adapt and learn, and the nervous system can change. And this is what we need to do. So remember, you have a stressed out, reactive nervous system, and we need to calm it down. Now you may think this, relaxation techniques, I know how to relax, but you know what? This is actually something that we can't underemphasize. We need you to be working regularly on calming that nervous system down. So clear the mind, calm your body, take time out of your day to actually work on this, just like you would if you were doing an exercise program. Take that time. Some of the best ways we know how to take that brain from fight and flight and put it into that stability mode is to use breathing techniques. Now, umbrella breathing is just activating those lower rib muscles and really engaging the diaphragm. And we're going to talk about that a little more in the pacing content of our program. So if you want a little bit more information about breathing, we're also going to be adding a breathing course to our program as well, just specifically about breathing to really get the right muscles engaged and help people really focus on the right technique. Muscle relaxation is another important thing to consider. Many of us, especially who have pain, walk around protecting and tensing up those areas, and we know that that's not helpful. It really just creates soreness in those muscles and tires them out, and really just adds to the amount of pain you end up suffering from. Movement, we really encourage people to move on a regular basis. Now, we more focus on the term mobility than exercise at this point, because For most people, when you're exercising, it's too much strain, it's too much stress on the body. So we just need you to move and move regularly. And ideally, increase that little by little over time. Now, this is one of the ways we can access those endorphins. As we do prolonged mobility, your body releases those endorphins, which can help again with managing your pain. We need to teach your brain that some of the movements that you can do that are available to you are safe for the body. So some activities, most people, we can find an activity for them to do, whether it be in the water in an aquatic setting, or doing a safe walk on a really gentle terrain. Most of those activities are safe for most bodies, and our doctors will reiterate that as well. Really what we need you to do is start slow intensity and go slow. Remember that pain system is reactive and protective. So if it feels like it's being stressed, it's going to react. So very gently increase what you can do over time. And we get into that more in the pacing class. Again, we're trying to avoid flare-ups. That's the key thing, and we'll get into that in a picture coming up here. Now, endorphin prescription, another way we can tap into endorphins is by finding some joy and laughter in your life. I know it might seem a bit absurd to be trying to laugh and smile when you're suffering in pain, but there are tons of evidence out there that when you find and can access that laughter, you will have a release in those endorphins, which can help reduce the amount of pain. It also really improves your quality of life. Find some things that will bring you joy, and try to not live a life of complete suffering. So find some things that make you happy and that you can add into your day regularly every day. Now this picture that comes straight out of the book called Explain Pain, written by Lorimer Mosley and David Butler, who are pain researchers out of Australia. We use quite a bit of their research and integrate that into our program. This diagram just basically goes to show down on the bottom there, you can see there's sort of a dashed red line and then a thick red line below that. And that's kind of, the thick red line is kind of your baseline, or where you have to start from when you're doing a mobility program. And over time, you can see you try to stay below that dashed red line. And if you're successful at doing that over time, you can imagine that each one of those mountains, a certain period of time, maybe a month, if you want to use that as an example. And you can see if you stay below that threshold or that flare-up zone, that flare-up dashed line, over time you do increase the amount that you're able to do over time without going into flare-ups. And that's exactly what we talk about in our pacing class. Now, healthy lifestyle is also really important. All these things are really important. Exercise, stress levels. We're going to get into that in a little bit here. But what I really want to point out is that this population is, much higher risk of having mental health concerns and issues. So we need you to reach out. If you're feeling like you're in a bad place and you're having, destructive and maybe dangerous thoughts, then please get that help. And there's mental health hotlines and phone numbers in every community. So please reach out. And on a couple of our handouts, we have the phone numbers for that in our area. Your thinking, your thoughts. We know that it's hard to be positive when you're in pain, but we also know that the way we think can influence our pain. Thinking patterns that can cause increased pain are worrying, helplessness, and victimization. If you're stressing about all the ways that you're suffering in pain and the ways that your life has been affected by pain, that usually ramps up again that stress response in your brain. And that stress response is just going to actually create more suffering for you. So trying to recognize when those thoughts are kind of, what I like to term is going down the rabbit hole, and stopping them and trying to take a different spin on them, try to focus on something else, get your head out of that space, because it's really unhelpful and it just tends to make suffering worse. So work on different strategies. Some very effective evidence-based strategies are meditation and mindfulness. And we have a class that works specifically on meditation and mindfulness. But you can find a lot of that information on YouTube as well. Find one that works for you. You know, start off with maybe 5 minutes of meditation, and then move up to a 10-minute guided if you prefer. You can also do a sitting meditation on your own. Gratitude exercise, you know, just give yourself maybe a pat on the back for some of the things you are getting through in a day, and maybe be grateful for some of the people in your life. There's actually a lot of, as well, good evidence that shows that our outlooks and our mental health is usually positively affected by that type of exercise. Now, nutrition, we want to be giving our body the best possible chance at being at health and wellness, and that means choosing, you know, one ingredient foods, fresh vegetables, and choices like that. We always kind of say shopping on the outside of the grocery store tends to be a better choice than going through those middle aisles. Triggers that can lead to increased pain. There is some evidence out there about caffeine and alcohol having an effect on your pain system. If you sort of consider, you know, having a responsive nervous system and then adding in a stimulant, there can be that effect. I have had a few people come back to me too and say they've had a reduced amount of pain once they, you know, took a month off and gave it a try. Up to you. I mean, it's your choice to see if maybe taking a chance and giving it that a try and seeing if that's helpful or effective for you. There's also a lot of good information on Pain BC's website. You'll see the link below here where it says Live Plan B. There's some nutrition information about how your diet can affect you. Now, we know that smoking is definitely not a good combination with chronic pain. It can actually even, for some people, lead to intensified feelings of chronic pain. You know, you have to imagine your body is working hard to get oxygen to all the muscles and tissues, and that's affected by smoking. It definitely can also has the effect of increasing your heart rate and blood pressure, which is, again, very unhealthy. So consider that, and maybe quitting if possible. Again, smoking and back pain, there's 3 times more likely to develop chronic back pain if you're a smoker. So that's something to consider. This study showed that there was definitely a connection there. Weight and chronic pain. We definitely know, and we have seen lots of studies that show that people who have excess weight tend to suffer more with pain in, you know, their low back area. People have more osteoarthritis, and this also affects mental health. Anxiety, depression is also more common. We see fibromyalgia, migraines, and there's lots of evidence that shows exercise and weight loss can decrease the pain you're experiencing and improve symptoms of depression, anxiety. So quality of life definitely improves for most people who are able to maintain a healthy weight. So a couple of questions that you might want to consider here is when we talk about pain, where is it generated? Where does pain come from? So if you said pain comes from the brain, you're right. That's the right answer. Pain does not come from our tissues. Pain is generated from the brain. When the brain feels threatened, it will create pain to try and protect you and that body part. So how does the nervous system physically change with chronic pain? So we talked about how the neurons, the spinal cord, and even the brain mapping sort of changes. So that all adapts and becomes more efficient at the pain process. Think of it this way. If you were training for something, you're training to learn a new language or to play piano, you practice that on an ongoing basis and you typically improve at it. And that's sort of what happens too with the pain system. It is improving because it feels like you're doing this regularly. This is something maybe that's important enough we should pay attention to and get better at it. So the pain system improves and adapts, and the whole process of the central nervous system sending those messages up to the brain and the brain responding happens faster, quicker, and better than ever, which is obviously not ideal. So how can we respond to those overactive danger signals? Well, that cube was a real good example of sort of knowing that there were a couple different ways we could see that information and interpret that information, meaning that some of these things that we're going to do may fire up that pain system. But if you are confident, if you ask yourself, is this safe for me to do? And am I going to be okay tomorrow when I do this, after I've done this? Ask yourself those questions. And if the answer is yes, then likely you are safe to do a lot of these activities and participate in these programs. So consider that. How can we respond to those overactive signals? We can try to dampen them down too with relaxation strategies. And remember those receptors, those little receptors that we talked about. How often are they replaced? 3 to 4 days, right? And why is that important? Well, because those receptors turn over in whatever state your body and your nervous system is currently in. So if those receptors are reactive, and if they turn over every 3 to 4 days, and we work at getting them a little less reactive, a little less responsive, then maybe we can have an effect in the next 3 to 4 days of ramping those down so that the next generation can also start to ramp down. So in summary, resetting the nervous system in chronic pain means understanding your hurts are not always an indication of harm. So you can have pain without damaging tissues. So that can already start to calm that system down in your head, knowing that every time I've hurt or I feel pain, I haven't damaged something, I haven't wrecked something in there, I haven't made it worse. Okay, so your hurts are not always an indication of harming with chronic pain. So pacing or graded mobility really means we need to be moving a little bit every day. I used to have 30 minutes up there a day, but for most people who have chronic pain, starting off there is a little aggressive. You might want to start off low and do 5 minutes and build up from there. And if you want to know how to build up safely, listen to the pacing and breathing content. Endorphin prescription, again, finding something you enjoy and you like doing that makes you smile, laugh every day. Ideally, you're doing that every single day. Winding down, you're working at calming the nervous system down, and that's really essential. Remember, we're trying to get that brain out of fight and flight. Fight and flight calmed, or with that running, that system, it's going to be a lot harder to convince your brain that I'm okay and I don't need the pain system ramped up all the time. So wind down, work that relaxation. We have some links as well that you can access for different techniques, body scanning and progressive muscle relaxation. Moving forward includes developing a self-management program, and that's what our resources on the website here are for. Try them out, give it a go, see how these work for you. Pain BC is a great website, especially if you aren't able to access any programs in your community, or you're too far away from accessing any programs. Please consider checking out their website. Live Plan B has a whole bunch of different information, webinars, videos, articles about how you can rebuild your self-management program. Also, they have a coaching option here. The third point down there says need a coach. They can connect you to someone who can help talk you through some of the more difficult moments or just give you advice. And they can call you on the phone, and it can be a really great program for people, again, who aren't able to connect with one of us. There also is a chronic pain self-management program that's run and based out of it's a Stanford model, but it's being run through UVic, and that travels around. And if you click on that link below, you'll find a workshop that's in your area, so something to consider. So what's next? So you've had your referral to our program. You've attended and listened to this course, which is called Explain Pain, or our orientation. Next on the list for you is to either listen to our pacing course or attend the doctor's appointment. Now, some of the groups that we do run here, low back pain, neck pain, qigong, pool, gym classes, mindful meditation, wind down, fibromyalgia, and total body pain. Now, a lot of those we're going to try and get up and running online. We have a lot of closures here, and we want to be able to offer that content to this population. So keep checking our website, or take a look around, and you might find how you can do some of those classes and get that information online. Our team members, we have pain physicians, occupational therapists, physical therapists, social worker, pharmacist, nurses, and psychologists. And as I said, dig in, start now, take a look at what we have, and get moving, right? I always tell people you got to get moving. We need to, the opposite of mobility is immobility. So we want to keep the body moving, keep active, but also taking those moments to relax and wind down. Some of the resources and references that we use, as I mentioned, Pain BC, that SelfManagement BC is another one on there. The NOI group, David Butler and Lorimer Mosley have a few different websites. The NOI group is one of them. Again, most of our content is sort of adapted from their book called Explain Pain. We also use Neil Pearson, his information. He's a physiotherapist from the Lower Mainland, and he has a lot of good information online. He has a 5-step program that's on Life Is Now, and it's free, so you can take a look at that and start with that if you need to get a few tips on how to get going. So in the event that you're able to attend our program, or you would like more information about our out-of-town workshop, you can give our office a call. Now you can see that this slide here is a bit out of date, but we will be offering these on an ongoing basis when our program and our clinic is reopened. So if you're interested and you are from out of town, then that's something you could consider at that point in time. Okay. Take care out there. Thank you for listening today. And as I mentioned, you can take a look at some of the other programs that we have available if you're interested.